So welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Board of Directors. Today's meeting is officially called to order. So for the record, please note that Erin Kelly is representing Deputy Mayor Ann Williams Isom. Karen St. Hilaire is representing Molly Wasso Park, both in a voting capacity. So next on the agenda is the adoption of the minutes of the Board of Directors meeting held on September 26, 2024. Are there any questions, comments, or suggested changes? Can I hear a motion to accept these minutes?
So,
All in favor, please say yes.
yes.
Opposed, say no. So the minutes are approved. During the executive session, the board received and approved oral and written governing body submission from NYCH&H Brooklyn, South Brooklyn Health. The board also received and approved annual governing body 2023 performance improvement and evaluation plan written submission from NYC Health and Hospitals Sydenham Diagnostic and Treatment Gotham Center, and the semi-annual governing body report written submission from NYC Health and Hospitals Kings County. Let me move on to Vendex approvals. Since we began the process of approving contracts prior to Vendex approvals, there are 24 items on today's agenda requiring Vendex approval. One has that approval. There are 8 items from previous board meetings pending Vendex approval. We will continue to notify the board as outstanding Vendex approvals are received. So I'm going to move to action items 6 and Frida 1.
For the next two resolutions, I'm going to recuse myself.
Thank you. So let me move to number 6, Dr. Katz. Do you want to read it?
Authorizing the New York City Health and Hospitals Corporation to execute an agreement with PFM Financial Advisors, LLC, for the provision of independent registered municipal advisor services on behalf of the system for initial period of 3 years and 2 one-year renewal options exercisable at the discretion of the system for an amount not to exceed $1,125,000. Okay, are you presenting, Linda?
Yes.
Great.
So Debt Finance Department is soliciting for independent registered municipal advisor services in order to contract with qualified vendors to provide advice and assist the system in financial decision-making related to current and future financing strategies and options. Our associated NTE for these services is $225,000 per year, which will be capped at a lower amount during years in which we do not have a financing taking place. Just to note that municipal advisor services were formerly referred to as financial advisor services. We may sometimes slip and call them that again. They were last solicited through a public RFP in 2017. PFM is the incumbent vendor providing these services and has been serving in the municipal advisor role since 2002. The last contract awarded in 2017 had a $170,000 not to exceed amount per year. And to date, we have spent $120,000 roughly. The criteria for our RFP, we established minimum criteria of 5 years experience with public financial advisory services, 5 years of experience specifically advising public voluntary hospitals and other healthcare institutions in debt issuance and other financing options, and must have advised on at least $500 million worth of municipal or healthcare bond deals in New York State in the last 5 years. We evaluated that criteria as follows: 40% for the vendor experience, 35% for the ability and feasibility to meet the scope of work based on the proposal, 15% for cost, and 10% for MWBE status. Our evaluation committee included members of the Debt Finance Department, the Corporate Controller's Office, the New York City Office of Management Budget, and the New York City Office of Controller. We issued the RFP in June of this year with a pre-proposal conference held in July. We had 2 vendors attend that call. We received 2 proposals as a result of the RFP. The evaluation committee submitted final scores in August and selected PFM as the top score. PFM, as I noted, is a prior incumbent in the role and has had a good performance. With respect to vendor diversity, we note that this procurement falls under OP 4058, which governs debt finance and treasury operations, rather than our standard procurement policy OP 100-5. There was not a specific diversity requirement within that OP. However, we did have the vendor diversity team review the scope of work for the solicitation. They found that there was no subcontracting opportunity as the vendors perform all of the work themselves. So accordingly, no goal was set. We did also, through the vendor diversity team, identify four MWBEs, which were directly invited to respond to the RFP, but none did. So again, our request to the board is to authorize the New York City Health and Hospitals Corporation to execute an agreement with PFM Financial Advisors for the provision of independent registered municipal advisor services on behalf of the system for an initial period of 3 years and 2 one-year renewal options exercisable at our sole discretion for an amount not to exceed $1.125 million. I'm happy to take any questions.
Any questions from board members?
Just really quickly, Linda, if you could briefly talk about how you expect to be using them over the next 5 years?
So we use them in a variety of ways. It's primarily related to our debt finance program, where they keep us advised of options, market conditions. When we are issuing bonds, they are very heavily involved in helping us manage the team that develops the proposal, evaluate the advice that we're getting from our investment bankers. They help us with pricing of the bonds. Very specifically, they have access to a broad, a great deal of data about recent sales and market conditions, and it gives another counterpoint to the investment bank analysis that we find very helpful. We also talk to them about alternative ways to issue debt. We may go to them for advice around investing on proceeds and other financial issues that may come up. We go to them as well.
Thank you.
Any other questions? Okay, let's take it up for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution is approved. Next one, number 7.
Yep,
Dr. Katz.
authorizing the New York City Health and Hospitals Corporation, the system, to approve and appoint 22 firms to provide bond underwriting services. Of the 22 firms, 5 will be approved to provide investment banking services and serve as senior managing underwriters, and 17 firms will be approved to serve as co-managing operators as designated on Exhibit A. Services will be provided on behalf of the system for a 5-year period. An NTE was not established for this RFP. Linda, please.
Thank you. So again, we're soliciting for a pool of qualified firms to serve as both senior managing and co-managing underwriters related to any proposed future debt issuance or placement by the system. We last solicited for underwriting services through public RFP in 2015. That RFP resulted in the selection of 3 firms to serve as senior managers and 17 firms to serve as co-managing underwriters. The procurement does not include a not-to-exceed amount because there is no contractual arrangement that results from this qualification. We would, at the time we were issuing a bond, enter into an agreement with the senior manager investment firm, and that firm would then work with the co-managers to coordinate and sell the bonds. We would, prior to any bond issuance, come back to the board for a specific approval to issue those bonds, and in that we would that would incorporate the approval to enter the arrangement with the senior managing investment bank, and we would at that time present a proposed plan of finance that would include proposed fees related to the specific transaction. So just some background on the purpose of the underwriter service. They assist with development and structuring of specific financing plans, market strategies, approaches for debt issuance, and to all designed to help ensure successful underwriting and marketing of, of our bonds at the lowest cost to the system. The co-managers, again, support the marketing and distribution efforts related to those bonds, and the bond underwriters may also commit capital necessary to help support the bond sale in the secondary market. The selection of these 2 pools was based on each company's ability to provide us with the highest quality service of financial market strategy and underwriting service. Appointment to these pools does not guarantee participation in any future bond issuance, and as noted, any bond issuance would be subject to approval by the board. For this RFP, we established minimum criteria for senior managers, a minimum of 5 years' experience as a senior managing underwriter of municipal bonds, and management of at least $1 billion of municipal and/or healthcare bond deals in the previous 3 years. For the co-managing firms, they had to have a minimum of 3 years' experience in underwriting municipal bond issues. And for all firms, they required the firm or key staff within the firm working on our team to be licensed by FINRA. For the criteria for evaluation, it was 50% to vendor experience, 40% for the ability and feasibility to meet the scope per the proposal, and 10% for MWBE status. Our evaluation team again included members of the Debt Finance Department, the Corporate Controller's Office, the New York City Office of Management Budget, and the New York City Office of the Controller. The RFP was issued in June of this year, with 31 vendors receiving the materials directly and posted on City Record. We held a pre-proposal conference in July in which 18 vendors participated. We received a total of 22 proposals. The evaluation committee in September submitted final scores for senior managers, selecting the top 5 scoring proposers: B of A Securities, JP Morgan Securities, Jefferies, Morgan Stanley, and Samuel A. Ramirez and Co. We, at the same time, in the same month, submitted final scores for the co-managers, and we chose to select all remaining proposers to participate in the co-manager pool. I'll note that the selection of 5 senior managers is an increase of 3, from 3 to 5, over our last selection. Given the changes in market conditions, we thought it was prudent to have more firms available to serve in that role. And we also thought that moving with a broader co-managing pool would also give us more flexibility to respond to market conditions or specific types of financing that we wanted to pursue. With respect to vendor performance, we performed reference checks for all of the newly qualified vendors, and all previous serving vendors were determined to have performed at a satisfactory or better level. For vendor diversity, again, this procurement was handled under OP 40-58 for debt finance and treasury, but we did involve the vendor diversity team to review the scope of work. It, again, has no opportunity for subcontracting, and so therefore no goal was set. I am very happy to report that one of the senior managing firms, Samuel A. Ramirez and Co., is a certified Hispanic MWBE, and it is the first time that we have a MWBE firm as a senior manager, and 7 of the co-managers are also MWBE firms. So our request again is to authorize the New York City Health and Hospitals Corporation to approve and appoint 22 firms to provide bond underwriting services. Of the 22 firms, 5 will be approved to provide investment banking services and service senior managing underwriters, and 17 firms will be approved to service co-managing underwriters as designated on Exhibit A. Services will be provided on behalf of the system for a 5-year period, and not to exceed amount was not established for this RFP. And I'm happy to take any questions.
Any questions?
Just to compliment, congratulations on the inclusion of 7 co-managers that are MWBs, and including, I guess for the first time, as a senior manager in MWB.
Yeah, we were very happy with that.
Okay, let's take it for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution approved. Number 8, Ms. Hernandez Pinheiro.
Oh, I didn't know it was me. Okay. Authorizing the Executive Director of Metro Plus Health Plan to access the remainder of the spending authority that was authorized in the 2014 resolution, approximately $17 million, and to exercise a best interest extension for 2 years of the contract term through December 31st, 2026, in 2 separate contracts with DST Health Solutions, LLC, doing business as SS&C Health, for a total combined increased spending authority of $35,100,000, including a 5% contingency to increase the total spending authority from $177 million to $212,100,000 to continue the provision of the core systems and services, including claims adjudication, accounts payable, enrollment support and communications fulfillment, business processing, outsourcing, and reporting to support operations, business, and regulatory requirements. That's it, Mr. Chair.
Thank you so much.
So to give you a little bit of a background on these contracts, so DST Solutions is MetroPlus's current vendor for core systems and services, and there are two separate contracts, our ASP and our BPO agreement. As you guys recall, a few months ago, we came to you for, more than a few months now, for a core replacement. And so while we're undertaking that large core replacement, which will take approximately 26 months in total, we need to continue operating on this platform. And this contracts are expiring at the end of this year. So we are currently undergoing a major core system transition entailing migration from the SS&C legacy system to the new Health Edge system platform. We need SS&C to continue to provide services until the transition to Health Edge is complete. And we are seeking authorization for the remainder of the spending authority that was authorized in the 2014 resolution, approximately $17 million remaining on that contract, and to exercise a best interest extension for 2 years of the contract term through December 31st, 2026, in two separate contracts for the ASP and the BPO, increasing the spending authority by $35,100,000, including a 5% contingency. The total spending authority for both contracts will increase from $177 million to $212,100,000. Some highlights around the two separate contracts. So we have an ASP service agreement for software license and hosting of production and QA and testing environments, management services, EDI clearinghouse, and interface application fees, and as well as integration into third-party systems. On our BPO is a little bit more extensive. We use them for membership reconciliation and premium billing as well, enrollment processing through another system called Market Prominence, benefits setup and maintenance, provider contract management, claims processing, implementing any regulatory changes, as well as mailroom support. On the contract background, SS&C has been MetroPlus's vendor for core system services since 1998. In 2014, MetroPlus awarded a sole source contract to SS&C to continue services after an in-depth review and evaluation of plant operations. We were unable at that time to move to another core platform, and so we stayed with SS&C. In October 2014, the MetroPlus board and the New York City Health and Hospitals board granted contract authority for 10 years for the ASP and BPO contracts through December 31st, 2024, for an amount not to exceed $177 million for the two contracts. MetroPlus now seeks to utilize the remainder of the spending authority that was authorized in 2014 resolution and exercise a 2-year best interest extension through December 31st, 2026, in order to exercise the 2 1-year renewal options in each contract. So this is a summary of the ask. We were asking to continue using the funds that were authorized in the previous resolution of $17 million. We're asking for a new authority of $35,100,000, including a 5% contingency, bringing our new total spending authority to $212,100,000 since the inception of the contract in 2014.
Thank you. Any questions? Frida?
After the transition to Health Edge, will these contracts, will Health Edge be taking over?
Correct. Health Edge will take over, and we will have, so our intent is to go live with our Health Edge in the beginning of 2026. So the remaining 2026 will most likely be a run-out contract, and then we'll be all Health Edge and no more SS&C.
Okay, so that was because they've been in place since '98 and this sole source contract and et cetera, but you guys you're doing a whole major.
Everything.
I remember that, you came here, right. So one question, just to clarify the numbers, I think, the chart, yeah, that's not additive, right? So the 35 million.
Correct. So we have the authority for 177.
Yeah.
We haven't used the full 177. We have 17 million balance. Our authority was up to 177. We're asking for an additional 35 million to bring us to the 212,
Right.
and also leverage the remaining 17 that was there. So it's not additive.
Right, in other words,
'cause-
said another way, the 17 is part of the 35.
No.
17 plus 35. It's going to be a $52 million spend
Over
over
2
2
years.
years of the extension.
Okay, but the 177 never hit 177.
Correct.
That's why the increase.
We hit 150.
Got it, okay. The math didn't work, so,
Sorry, 160.
right, okay, good. And then I think there might be a description in the whereas clause of the resolution that, it might be this math problem again for me. It's the second to last one, seeks additional spending authority of 35.1 million for the 2-year extension period, a total contract spend of 212 for both contracts for the 2-year period. I don't think that's true. Right, the
No, it's
212 is
It's for the duration
entire
since
12
we've had the
year
contract,
period.
correct?
Right, so I think we just need to make an amendment in the resolution
Got it.
for that. Yes, absolutely. Thank you. That's it, thank you.
Any other questions? Okay, so let's take it for a vote. All in favor, please say yes.
Yes.
Opposed, say no. Resolution is approved.
Sorry, just with that
Yeah,
change.
with that,
Can I make sure, let me
Yeah.
make sure that I have that change. Oh, I'm sorry, I didn't quite get that. Thank you for saying that.
Second to last whereas, where it talks about the 35 million additional.
Okay, so it's just the whereas clause that needs to change, not the
I
actual
think,
language of the resolution.
I mean, I didn't double check that, but I'm pretty sure.
Okay. Okay, so just eliminating for the 2-year period. Okay. Just through. Okay, great. And then because the resolution isn't changing,
We don't need
the
to
vote itself is okay. We'll just make a note of that in the record though for the whereas.
it's late in the afternoon, we just voted, right? So we did.
We did, we voted, and it's all fine.
Good, thank you. Thank you.
President's report?
Yes, so I noticed these president's reports keep getting longer and longer. And it's just because so many great things are happening that people want you to know about. The staff really cares for the board to know their accomplishments. So I don't want to read every word because it's not about my reading it. It's more about your knowing that so many great things are happening. So we recognize Breast Cancer Awareness Month, and Christina did an amazing, you should watch, her on camera. I think we have to give credit because she kind of stole the idea from George, who remember did the colonoscopy one.
Right.
And that was such a success, and so many people appreciated George, doing it on camera, that Christina said, well, I'll do one for Breast Cancer Awareness Month, and it's really terrific. So I recommend that you watch it. We believe strongly that the members of our long-term community should be able to vote, and we make it easy for them to vote. We did a large effort at Seaview on voter awareness. The White House came to us to talk about pandemic preparedness, and you may have seen there's a lot of stuff going on about bird flu, which at least seems to still really be in birds. But there have been now a couple of cases of human transmission. Doesn't seem to be easily transmitted, but I think the important thing is that people recognize how critical preparedness is. We have great relationships with our sister agency, DOHMH, and want to make sure that we are always a good partner. We celebrated the 10-year reunion of the healthcare providers following the patient who recovered from Ebola, the only patient in a New York City hospital to recover, a very big deal. Elmhurst became the first hospital in Queens to offer this very innovative hepatic artery infusion chemotherapy for treating liver cancer. Carter received an accreditation, but I think better to say Carter has always been a lead in the ability to wean patients from ventilators. You look at their stats, they're off the charts in terms of how to get people off ventilators. And whenever I get called about a patient on a ventilator, I always say you should go to Carter. Carter is absolutely the best place, but this formalizes it. New CT scanner at Harlem. We got $150,000 in city funds from council member Stevens, which we appreciate, that will go to enhance patient services at Gotham. When we did our finance committee report, we are doing very well. We finished with a positive net balance variance of $178 million, or 1%. So we're doing a great job financially. Eric Way, who you know has been, a tremendous part of the success of Health and Hospitals, including having previously been interim CEO at Harlem, Elmhurst, and Lincoln. Thank you. I knew there were three. In that process, he kind of caught the hospital bug, and has decided that he would like to spend the next phase of his career running hospitals, and so he is going to be the new CEO of Bellevue, which has been incredibly well received at Bellevue. They are really happy, and Bill Hicks, who's been a transformational CEO, is incredibly relieved because I think I know for a fact he has wanted to retire for some time and has not retired because of his commitment to Bellevue and his love of Bellevue, and wanting to make sure that it's well cared for. So he was thrilled because now he feels confident that he can retire without worrying. And we wanted to make sure this went well, especially because Nate Link, who has been the CMO for 12 years and equally good as Bill, and they've been a phenomenal team together, is also retiring. Nate is most famous for the just say yes to the transfer, right? That's been his policy, right? Just say yes, right? Somebody calls you up from Health and Hospitals and says we need to transfer a patient, just say yes. Don't say we're tight on space. Don't say we may not. Just say yes. And it's not only made Bellevue a successful quaternary transfer center for us, it's made care better for the rest of the hospitals. It's united us as a system. But while he is stepping down after 12 years, he's agreed to continue as a hospitalist at Bellevue. He loves patient care, so he won't be full-time. He's going to be 0.6 time, but he will also be around to help Dr. Amit Apal, who you have met for a variety of presentations, a incredibly strong ICU interventionalist, did a lot of our level loading through COVID, worked closely with Eric during that time. They're going to be a great team, and so I have tremendous confidence. Cranes recognized the amazing Black leaders who are at Harlem, including Sean Ajibade, at Harlem. Excuse me, no, Sean is at South Brooklyn. At Harlem is George LeConte, who we were just speaking of, and also Cedric Oliver. So great people, and we were happy that they were recognized. One of the things that Natalia has done so well is to really elevate professional development among nursing all the way to the doctoral degree. And she has these annual parties to celebrate the circle of doctoral level educated nurses. I had the privilege of going with her. She has the numbers that this year we had 38 new nurses graduate into doctoral practice. And so now it's 38 plus the 107. And she has it at every level. And again, I think this is something she has seen as a huge need, that people in nursing really see the road to education and to continuing on their studies. So, you know, I think that was terrific. The Brooklyn Power Women included Angela Cooper, Lisa Scott McKenzie, Sienna K. Denham Wilkes, and we honor them as well. Our own chair here, named to the 2024 Latino Power Players List, and we're very proud of you, Jose. We celebrated a one-year anniversary for our telehealth abortion care. I think these numbers are pretty amazing. In the first year, we provided over 2,700 virtual visits, mailed over 800 medication abortion kits, and referred an additional 1,050 patients for inpatient care, recognizing that this kind of reproductive health care, and that is how we think of it. We think of this as health care, is not available, sadly, to all women in the US, and we make it through our virtual care available. We remind people to get their flu and COVID shots. I got mine. It's on our social media, one in each arm. And we are making progress on being able to take care of our asylum seekers in a positive way, while also eliminating the larger sites, which were never ideal. And we were happy to close one of the very large sites. We don't see that as a good model. That was an emergency model. And now we're going to continue to work with our other sister agency, the Department of Homeless Services, to get everybody into an appropriate place. I think with that, Mr. Chair, that concludes my report. There's more detail in it, and of course, I'm always happy to hear people's suggestions and answer any questions I can.
Thank you, Dr. Katz. Any questions from board members?
Congratulations on the 12 pages.
Yes. Thank you. Sorry so long.
No, it's great. It's great to see all the accomplishments in one place, because it's, you know, it's hard to keep track of everything that happens at the system level. So, okay. So the committee and subsidiary reports. The committee and subsidiary reports were emailed to you and are in your electronic folders for your review and submission into the record. Are there any questions or comments about the reports? Is there any old or new business from board members to come before this board? So hearing none, the board meeting is adjourned. Thank you so much.
This meeting is no longer being recorded.